Welcome to the CodeCast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the CodeCast podcast. Today, my name is Terry Fletcher. So today, I'm actually going to talk about a topic that seems to be popping up for me lately in almost a faceplant. I'm banging my head against the wall, and I really want to bring it to the forefront because this could affect you, your job, your practice, your providers, and really your role in healthcare as it relates to bringing people in, maybe a consultant, or you giving a presentation. Maybe you're the one explaining to your physicians why they can or can't do something in the revenue cycle management department, or if you were a clinical documentation integrity specialist and you're trying to explain to the physicians why they need to document or why they, can be a little bit easy on another documentation issue. But what I'm finding right now is that it seems like everyone wants to call themselves a subject matter expert, an SME. And for me, that's a problem. Subject matter experts, they have specialized knowledge in a specific area of expertise. Okay, so right now, because we have access to endless knowledge on the internet, it seems like the modern world is filled with what I like to call generalists, where you have somebody that can basically Google something and say, oh yeah, I know what you're talking about, when actually they're just taking an opinion from Google, or they're taking an opinion from an AI source, which we have found now that, about 50% of those aren't accurate. And so there are still individuals who choose to focus their attention on one field. For me, it's healthcare, coding, billing, and auditing, and now compliance, but I'm doing my homework. For example, I just got my additional credential in prior authorization work, and that was important to me because I started getting a lot of questions for it, and I would send that out to somebody that I knew really worked in that area. And I wanted to make sure that not only did I research the topic, but that I was gaining more and more experience, collaborating and talking to my clients in the physician practice setting, and then again, getting my credential in that area, not to necessarily be called an SME, but to be able to have a working knowledge where I felt that I did understand that topic. Now, most of you know, I'm in my 40th year of healthcare, been in a long time. And if I call myself a subject matter expert, what would that be in? Well, if you go to my website, I have a list of my specialties. My number one specialty is cardiology and peripheral cardiology, which is outside the heart, typically dealing with extremities, carotids, which are in the head and neck, and then obviously in the abdominal area or renals. And then my second one would probably be evaluation and management, telehealth, and that kind of all goes into one, primary care, and then gastro, and then limited on orthopedics, basic, and you can look at my website and see what my specialties are. But the thing is that I do get some practices that'll come to me and say, hey, Terry, I have a question on what is something recent? Oh, spine surgery. And do I say I'm an expert in that? No. I would send that over to a friend of mine, Jennifer McNamara. If somebody's talking about infusion therapy, I would send that to Stephanie Allard. If it is dermatology, I have a working knowledge of that, but I'm not an SME in that. I'd probably send that to Christine Hall. If it has to do with legal work, or it has to do with defense work, meaning that the doctor got a U-pick, or there's, some kind of audit that I don't handle, then I'd probably send it to my friend Sean Weiss. So, and a lot of people are like, no, I just keep everything that I get an inquiry about, and then I look at Dr. Google, and I'm just like, oh no. Or I've had people say I get my information off Facebook, which I haven't been on Facebook for 11 years because I hate it. I mean, I'm just going to put it out there. I absolutely hate it. I just think it's too controversial, too political, and I have conservative views, but that just gets mean. It's like a Mean Girls for the world. But what's weird to me is that so many people want to say that I'm a subject matter expert, and without a specific knowledge in a topic. And remember, when you're dealing with subject matter expertise, the person that you're looking at, their competencies are developed through years of on-the-job experience and education in their field. It's not enough just to be an experienced person in your role to be considered an SME. We are lifelong learners who specialized in one unique aspect of our job or our area within that subject. So, for example, like I mentioned, I can be a subject matter expert, let's say specifically on cardiology. I can just look at a claim and know if it's accurate based on just, over 35 years experience in that specialty. And we've had changes in the last 15 years, and then we've had more changes in the last 10 years, the last 5 years. And so I can tell if somebody's used the wrong modifier or the wrong sequencing of codes, or if they're including things they shouldn't, or if they, if something just doesn't look right based on the linking of the diagnoses and the coding. And for those of you that want to say that you're an expert in a certain subject, you have to be able to do that too. Just look at it and if it's something that you have to research and figure out and estimate and plan and really take the time to figure out if you're right or wrong, and you're trying to get all your information from the internet, it's not that you can't respond to a question or you can't, present a topic. That's okay, but in general, you have to be careful because you need to know what you're doing. You don't have to have somebody, and they call it hand-holding or assisting you in your work. That's why they're called an SME. So can you just be an expert that can find the answer? Yes. But should you be able to, or should you be willing to, I should say, to hire somebody that can assist you if you need it? Yes. Please make sure that if you are going to say you're an expert, you are, based on not just your experience, but also how you back it up with either credentials or education or, examples or even references that somebody knows, how to handle certain things. I've seen subject matter experts or somebody's calling themselves that, where they seem to think they're an authority on social media and, how to create social media strategy or engage an audience. Instead, they end up just hurting the person that they actually engaged. And if you're going to be someone that's going to engage in a consulting job, and if you're going to be, say, a project manager, or you're developing a new compliance program, or maybe you're launching something for a human resources department, or you're being brought in to train a coding department, you need to make sure that you know what you know and what also are your limitations. Because every subject matter expert, even though they can be helpful, they have some kind of limitations. So for one thing, if they're a consultant, they may have, a level of knowledge that is different than in-house experts. This is important if you're working on, a service, for example. So let's say somebody's helping you with something you were hacked and you had to hire an SME consultant to deal with software hacking, which unfortunately is happening every once in a while, especially with cyber. We all heard about the Change Healthcare situation. But if that person you hired, they don't have a good understanding of that product or how it works, they're not considered an SME. Do you have somebody internally that maybe has more experience or deals with something every single day? That may be something that you really have to engage that person. Now, one thing I really try to do, and this is for anybody who's looking to build their reputation as an SME, sometimes you can run the risk of getting tunnel vision, where they can't see the big picture because they're so laser focused on their topic. One in particular is telehealth, and I am a huge proponent of telehealth, but sometimes in my discussions, I notice that people feel like maybe I'm against telehealth because I'm always talking about how it needs to be an addition to your in-person care. And it's one of the ways to deliver medicine. It should not be the end all, because there's certain situations where it's not a likely visit in a telehealth situation. And so this is where I am very clear to make sure that I don't just get laser focused. I'm open to the discussion and making sure that there are possibilities for different opinions on the topic and really figuring out on those broad questions, what is the challenge? And that's a big thing when you're a subject matter expert. You have to figure out, well, what's the challenge? How can I make sure that I'm not leaving anything left on the table? There's a lot of new things that, even in coverages now that I'm seeing with Medicare, some of the Medicaid plans, some of the Medicare Advantage, and even some commercial, even though they seem to be the ones that are not covering a lot of things, especially in the mental health, behavioral health, or now, I don't want to call it coaching medicine, but lifestyle medicine. They don't cover as much as what Medicare is putting out there saying they cover. But you have to also be clear that just because it may be covered for that particular provider, if you're going down that route, you have to know then if it's covered, what are the what's the published guidance, what's the rules regarding coverages, and just not say, oh, well, if I have a nurse practitioner, I can do this, or if I have an RN, they said I can do this. No, you have to make sure that you have what they say. No, dot every I, cross every T. Don't leave any stone unturned to make sure that your expertise and any credibility that you have, that you're lending to your subject matter at hand, that you have done your homework, that you have information that can be cited, resourced, and that you can say, this is where I'm getting my information, and make sure it's something credible. Recently got an email from a client. Actually, it wasn't a client. It was one of you, the podcast listeners. And I appreciate my listeners that sent me something, and I appreciate all the feedback. So thank you for that. But she had said something like, I had commented on one of my podcasts a couple of weeks ago about seeing patients via telehealth where the patient isn't present, or seeing them in the office where the patient isn't present. And I'm going verbatim from what the CPT book says. Yes, on page 4, it talks about place of service, patient and or family, but it doesn't talk about seeing the patient in the code descriptor of an office visit without the patient present. And so I go by that. And also Medicare is very clear on it that you can't do that. Medicaid in different states will allow it for pediatric, but unless you're going directly to payer policy, you can't just say, well, I'm going to do it because the Optum coding expert says I can, or because another publishing product says, you can do it this way. Remember, they're publishers. They're trying to sell a book. They're trying to sell something, and not to discount the services or the publications, because I have publishers too. I have a book with MedLearn Publishing. I also have my own books on my website at terryfletcher.net, but we are also, desktop publishers are actually publishers that are taking information from authoritative resources, CMS, state information, Medicare Advantage policy plans, private health insurance, their actual policy provisions. We're getting this published guidance so we can cite where we're getting this. We're not saying that, and that's making us that subject matter expert. We're not saying just listen to us and take our word for it. And if you have anybody that says that, you definitely need to move on. So it's where do you get your cited information? And if you're getting somebody that's saying, just because I read this book that isn't a CPT assistant, isn't a reference or resource that is followed universally, then it's just something that is a side helping publication. Then you're going to have trouble if you're ever in a defensive position where now you've got legal issues. So just kind of bringing it back to the topic of today, if you're a subject matter expert or you want to be looked at that to lend credibility to your work, make sure that you have researched your position. You have cited resources and references. You have the experience in that particular topic or subject, and that you're not just, and I hate to call it this, but not just winging it just to get the money in the client. That is just the wrong thing to do, and it hurts you, it hurts the client, and eventually it'll come back to kind of bite you later, and you just don't want to do that. The CodeCast podcast is also brought to you today by Just Coding, your online continuing education destination. Pay one price and earn dozens of AAPC, AC, DIS, and AHEMA credits annually. Save 10% off a new subscription using the coupon code SAVE10. Visit justcoding.com to subscribe. So today, my coding question, kind of interesting. Question comes in about the 76937, which is ultrasound guidance. For access to a patient. So a lot of In the cardiology specialty, a lot of providers use ultrasound guidance to access the common femoral area to introduce a catheter for a heart cath. But also providers do this as well. Physicians do this to access the lower extremities to do peripheral procedures or non-coronary procedures in the lower extremities, for example. Well, this is bundled routinely in coronary procedures since 2019, but it's not bundled in non-coronary procedures. And because it is a 70,000 code, if you're providing this service in a facility setting, remember your 26 modifier, and you will probably need a 59 because it does have an edit on it. But that question came up saying, I can get this paid on my non-coronary work and peripheral work, but I can't get this paid on coronary. It's because it's bundled, and no modifier is going to help you in the coronary side. So keep that in mind. A personal tidbit this week. So it is, we're now late in May. I'm excited. My daughter's coming to visit for Memorial Day weekend upcoming this weekend. So we're hoping to have kind of a nice weekend by the pool and just really kind of chat. And I'm celebrating a 25th anniversary coming up this summer. So since she's now in Arizona and we're in California, we're going to hopefully celebrate early because then I won't see her for a little bit after that. But everyone, I really hope you have a good week. Make it a great day. And thank you for listening to the CodeCast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.